Welcome to Deep Dive Dialogue on the role of proton therapy in shaping the future of precision oncology, challenges and opportunities. Proton therapy plays a crucial role in precision oncology by offering highly targeted radiations, minimizing damage to surrounding healthy tissues. It holds great potential and promise for personalized treatments, especially in tumors near critical structures. However, challenges such as high cost, limited availability, and the need for future clinical validation must be overcome. To discuss this hot topic, we have with us Dr. Ashu Abhishek. He is a senior consultant at Apollo Proton Cancer Center, specializing in proton therapy, cyberknife, and precision radiotherapy. With advanced training and observerships at renowned institutions like Miami Cancer Institute, Maryland Proton Treatment Center, Mayo Clinic, and Aarhus University, Dr. Ashu has developed significant expertise in this area. Welcome, Dr. Ashu.
Thank you, Dr. Kurana, for the kind introduction. I think it's a very nice thing that we are talking about something very niche because as even radiation per se, people are so much scared about. They don't know much about what it is, and when we talk about cancer in general, it's more sort of a social stigma. And then earlier people used to still get away with it because not many cancers were there. I still remember my postgraduate days. I used to get one call in a month that someone has a cancer, right? That was around 25, 30, 25, 20 years earlier. And now it's almost like every week we get three or four calls. Someone's brother, someone's sister. So cancer is like so much rampant.
Yeah.
So it's a continuous struggle for all of us as caregivers,
Hmm.
as attendants and patients to win over this disease, which is really a major concern for now. And all these newer developments, and thankfully it's happening in all the fraternities, be it medical oncology, surgery, radiation. So obviously proton is also something that now we are proud of,
Yeah.
now having it in India. So it's really something to be proud, and more people can get benefited who deserve that.
Right. So I think audience should know that what is proton therapy and how does it differ from the traditional radiation therapy.
Right. So it's an important question because I'll tell you many a times we do get a lot of queries through phone and mail
Hmm.
saying that our disease is so and so and we have done so and so things. So can we take proton? So in general, for anyone to understand, one thing we always like to promote is, see, cancer is something that is definitely a very bad disease
Hmm.
for sure. But then
Hmm.
if we detect it early, there is still treatment possible, cure possible. So
Hmm.
majorly your treatment will depend upon the stage, whether it is local or spread out. And depending on the stage, there are three main modalities of any cancer therapy. One is removal, that is surgery. Now that surgery can be small, big, laparoscopic, robotic, so there are different layers to it. Then there can be medical management. Now medical management can be simple hormones, or it can be, people generally know it as chemotherapy, but chemotherapy is like a medical management where it can be hormone, it can be targeted. Immunotherapy is also a form of medical management.
Hmm.
And then the third major pillar of cancer management is radiation.
Hmm.
Now again, radiation also, it has multiple divisions. So primarily we divide radiation into external, which is the major treatment that we see, or internal, that is brachytherapy.
Hmm.
In external radiation, where you're giving radiation from outside,
Hmm.
it can be in general photon or simple X-rays. So X-rays, we all know, these are diagnostic X-rays that we use in CT scan, in X-rays, to diagnose, to see what is there inside. But when we use these as a focal treatment to
Hmm.
treat or cure cancer, that is called as radiation therapy. So when we use photons, that is almost like all the hospitals will have a photon machine, a linear accelerator. So all these IMRTs, IGRTs that normally people will use is in terms of when we say how we are delivering radiation, that is primarily divided into majorly photon. And then we have something which is new, that is, it has like protons, they are basically charged particles that are used for radiation therapy. So
Hmm.
we should know that proton is still a radiation therapy, a
Hmm.
different way by which we deliver radiation.
Hmm.
And primarily it's been there earlier as a, people used it for scientific purposes for various nuclear reactors. And then when they saw the benefits of a very charged heavy particle, and that is how proton therapy came in, right? So I can go ahead and just explain briefly what is the difference between photon and proton.
Hmm.
So if you are subjected to radiation, so
Hmm.
first decision generally will have to be, do you need radiation or you need chemo and surgery. So once you are decided with radiation,
Hmm.
then there is a difference between photon and proton. In general, what we say is protons are heavy particles
Hmm.
and they are charged particles, because of which we say that in protons there is no tail dose.
Hmm.
Means if you deliver radiation, then we can decide a depth at which the maximum dose delivers, and then subsequently all the normal tissues beyond that doesn't get that effect. So very classically it is termed as a waterfall effect. So like
Hmm.
in a waterfall, you see a sudden fall and then
Hmm.
there is nothing after that. So similarly, proton is good for those tumors
Hmm.
where you have to save the normal structures from getting extra dose. And you know, as oncologists, as doctors, it's our also a perspective to decrease the iatrogenic damage. That is, the cancer is doing although so much bad,
Hmm.
but your treatment should be selected in a way so that your treatment has least side effect
Hmm.
and deliver the maximum dose to the tumor and get the best effect of cancer.
Right. And my next question would be around the cancers, that what type of cancers do you see the most promise for proton therapy and why?
So as I said, basically, we divide cancers into solid cancers and blood cancers. So blood cancers are all hematological malignancies, leukemias, and all those where majorly chemo is the treatment. All solid cancers means any body part, brain, lung, breast. So all these are various solid organs where if you have cancer, depending on the stage, you will require either surgery or radiation or chemotherapy or a combination. So
Hmm.
wherever radiation is needed, the sequence can change depending on the organ side and the stage. Wherever radiation is needed, proton definitely. So wherever a normal radiation can be done, proton definitely can be done. But
Hmm.
then considering two major facts, one is the limited availability. So as of now, it was Chennai that proton first came in India in 2019. So this was the first center in 5 years, and now TMH Mumbai has it. Now there are more centers being planned, so we may have another 5, 6 more centers in 3 to 4 years. So one is your limitation, and obviously there is a slight difference of the cost, which makes it not available to each and every patient, and
Hmm.
that's how we have to select the appropriate patient where we have a maximal benefit. So to begin with, Proton started with basically, and it's supposed to be the category 1 indication for all CNS, that is central nervous system tumors like brain, spinal cord. It is very good for pediatric tumors, the
Hmm.
childhood tumors, because see, wherever you presume that your patient will survive long, the
Hmm.
longer the patient survives, you need to have a least collateral damage.
Hmm.
And if you are able to save the smaller doses now, the subsequent damage, the subsequent radiation effects, be it the morbidities or second cancers, can be reduced. And that's how proton is beneficial. So CNS tumor, pediatric tumors. If we start from above, so now head and neck is a major indication. The last 10 years, the utilization has increased by 400 to 500% in US for head and neck tumors. When we come down to just anything close to the heart, be it mediastinal tumors, thymic tumors, breast cancers, cardiac tumors, lung tumors, which are central, they will have benefits of proton. If we go to GI, in GI especially liver cancers, cholangiocarcinomas, and then lower down rectal cancer, especially in young females, young patients, proton is definitely something which is very good. All retreatments where the patient has received radiation in the past and requires a second time radiation, proton definitely is something that we'll always think for. All large tumors where it is very difficult to save the doses to the normal structures, proton definitely should be thought for.
Right. And my next question you have partly answered, like the waterfall effect and the charged proton are the charged particles. So, how does proton therapy enable greater precision as compared to the traditional, radiation therapy, and particularly this spare the
Yeah.
healthy tissue
So
as
if
well?
you see how radiation has evolved, when we were postgraduates, most of the machines were generally cobalt machines. So they naturally emit X-rays that we use using a machine. So those times patients were treated just by 2 or 3 fields or 4 fields. That means giving a parallel like anterior posterior beam. So it's something like you want to give 100 dose to the tumor. You divide anterior posteriorly, so 50-50. So the tumor receives 100, but the normal tissues are divided into half. If you divide into four beams, then each side will receive 25%. That was the smartest way of reducing the dose to the normal structures. And like a cycle, from different spokes, you come to the center. So you treat the tumor with X amount of dose and redistribute in the body. So that is the principle where your 3D CRT, your IMRT, your IGRT, all these different techniques of radiation came in, where you try to modulate the dose along the tumor and save the normal structures. So this is one way of improving your precision, that is using different modalities. Be it you are giving in an arc, so we call it as rapid arc or VMAT. These are arc rotational therapies, tomotherapies, IMRTs. So these are general photon methods. So this is one major way of how you increase precision. Second, you do a onboard imaging. So every time you take up a patient, you do a CT based plan, so that you don't mark the patient externally. You are seeing what is there exactly. As a doctor, mark the normal, abnormal, and ask the machines. All present days radiation is computer based. So it's all algorithmic. It's all computer based plans, which can be re-verified, can be made much more precise and better, so that your precision is very thin, like a hairline. So by using these methods, you increase the precision. So this is something that is invariably machine dependent. You use a different type of machine like IMRT, IGRT, image guidance, and you can deliver these precise therapies. In Proton, you have all these, that is image guidance, you have precision of delivering by various methods, but on top of that, you have an additional factor, in fact, two additional factors. One is being a charged particle, and because it deposits a dose at a depth, because of the waterfall effect, you deliver no exit dose. So your normal tissues are much more reduced from the doses that they normally go. Secondly, we also believe that your protons are biologically effective 1.1 times. So if you are delivering 100, the biological effectiveness is said to be 110. So these are the two major key factors by which the same precision with an additional positive particle, with a heavy particle, you deliver with precision, and then you have a dose or radiation that is biologically more effective. And that's how it's supposed to be good in all the cancers where it can be used.
Right. And imaging, play very important part, and especially the AI tools also coming. So my next question is that what advancements in imaging and treatment planning are helping to refine proton therapy delivery?
So I'll answer it in a more general way first, because imaging has been really a boon to cancer therapy, especially in radiation. As you know, when we were postgraduates, there were old machines. We used to mark on the patient, and still patients were getting better, right? But then, as you develop your science, not only your tumor control is starting to getting better, you also are thinking about the collateral damage and the other things. Because if you're having a precise therapy, you can concentrate your dose better, the chances of misses are less, and that's how imaging came in. And imaging is not only about delivery. The use of imaging starts right from the proper diagnosis, because a patient may come to you with a symptom. A good imaging, only CT scan is good, but then we have MRIs, we have PET scan. In PET also we have different modalities of PET which are disease specific. So by using a good imaging, first you diagnose, you understand what you are dealing with, what you need to treat, whether surgery, radiation, what is going to be benefited. Once you have done that, once you have staged that, then all radiation today is a image based planning. So your planning is done on CT scans. Now even MR based Linux systems are there. So based on your CT or MRI, you do a radiation planning. Now once you have planned, then you deliver that radiation. Now I can do a very good planning on a system, but on the machine, if the patient is not in the same position as I had taken the scan, the whole precision gets defeated. So nowadays, every patient will have an onboard imaging where you take a virtual scans on the couch, and your couch or the treatment base is such that within millimeters you can correct the patient position. So what you have planned on a system, the same things you deliver with precision, and that's how imaging helps. Once you have delivered these patients, follow-ups are important to understand what your treatment has done. So imaging helps in assessing a complete response, a partial response, and most importantly, never ever once you have treated a patient, you can say your treatment is done, now no need to come back again. all the patients require regular follow up because cancers are notorious to come back. And that is how first we have to achieve a point where we have at least got hold and controlled the disease, and then have them on a very stringent follow up so that earliest chance of a small recurrence you treat them then and there so that further progression can be reduced. So then again, imaging is very helpful in those cases to detect early recurrences and plan a further therapy.
Yeah. And with this talk, we get to know that it's got a huge potential. So, how do you envision that proton therapy advancing over the next decade? And what factors do you think will drive its development and application?
See, the thing is, normally in medical science, one obviously the doctor is important, right? So, especially that goes with surgical skills. So, you will obviously go to a surgeon who's very good in his surgical skills because there needs to be a finesse in which he operates, he does a very good surgery. But at the same time, robots and the machines help them. So, similarly, radiation, we are not dependent on computers, we are not dependent on machines to deliver that high precision and good therapy so that we can achieve all the best care, right? Now the problem is, and that's for all surgical, medical, and radiation. As doctors, we want every patient to get best of the therapies, right? Because disease doesn't have international boundaries. So why should a patient sitting in Sri Lanka or Bangladesh or India is not subjected to a therapy which is state of art and which has just come up with a lot of promise? But then considering that there's a lot of research that goes in, there's lots of cost involved. Unfortunately, in India, there will be an Indian who will be sitting in US or Europe and developing this machine and then selling it back to India rather than us Indians developing it in-house. And why will a cost so we get so many international patients coming to India? Why? Say for example, Proton machine. The cost of Proton machine, whatever it is, say for example, it is $100, just for example. In US it will be $100. In India also we buy it at $100. But still, the cost of treatment in US may be $10. In India, it will be only $1. Why? Because the manpower is cheap, electricity is cheap, and then we also work on numbers. So definitely in India, there's a lot of prospect of making the patients be benefited with this technology. We waited for this technology till 2019. It was used in US, Europe. There were few patients who required therapies, retreatments where they had to go to US, Europe. But now, at least fortunately, they can come to Chennai or they can go to Mumbai. So at least these are the initial first two places, and I'm sure the newer centers that are going to come up will come up with modern facilities where the carbon footprints are reduced, where technology helps us in reducing the cost. Because of numbers, the cost can be reduced. Because right now, I feel technology wise, we are not challenged. We are challenged in terms of two basic logistic issues. One is availability at all the places, and secondly the cost, which is obviously high for anything that comes up new, but gradually with more and more demand, with more and more production, that will definitely come up. As scientists, as doctors, we also try to find out how we can reduce the cost, but it is a more admin and a manufacturing thing. But probably once India starts to develop more and more Indianized things, probably it will be much more feasible and better. And one thing I really like from Italy is, because see, at this moment of time, a single institute cannot think of having these large machines and treating their own patients. We have to think in common. So, what in Italy they did was they established a proton machine as a single point where five, seven, eight hospitals collaborated together and they treated together these patients. So, that is the principle on which we should work. Not every hospital will have a good machine, but if we start thinking like the whole India, probably we can have at least to begin with four machines like this, and it goes with robot, it goes with radiation machines. So maybe east, west, north, south to begin with, and then we have zonal centers where we have good areas where these patients, no one single person owns this machine. It is for the patient. Anyone who wants can walk in, get this treatment done. That's how the benefit can be given to all the deserving patients.
Well said. And I also believe that proton therapy holds great potential and its precision is, the future, and overcoming the challenges as such as cost and accessibility, we can unlock its full potential. Thank you so much for joining us today.